Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Today we're going to be talking with Dr. Jaqueline Worth, who is a co-author of a new book, and it's really peaceful, calming, and it's actually called The New Rules of Pregnancy. So it explains everything about pregnancy, and it guides women through labor, delivery, and the beginning of motherhood for many people. So Dr. Worth has been an OB-GYN doctor for over 20 years, and she's now working at Mount Sinai Hospital in New York City. So Dr. Worth, if you wouldn't mind welcoming everyone to Your Family's Health on the voice of Nassau Community College 90.3 WHPC, and would you mind introducing yourself?
Oh, yes. Well, welcome. Well, thank you so much for speaking with me today. You know, my name is Dr. Jaqueline Worth. I'm a mother of two teenage daughters, or one's 18, one's 22. I live in New York City, and I've been delivering babies for about 20 years here in this city. Pregnancy, prenatal care only, so I don't do any gynecology. So I spend my days and nights exclusively talking with pregnant patients and delivering their babies. And I've got a lot to say about how to help it go well for you.
But many people in your role, right, many doctors, they don't go to writing a book. Why do you feel the need to be partnered in a book that is so beautiful? I just have to say, I love the cover. I love the photos. Everything about this book is calming, and it's really nice. So what made you do this with your peers?
Oh, thank you so much. Well, you know, exactly what you're bringing up, which is that increasingly I see moms, young women, older women, really anxious about the pregnancy and the delivery and worried about all the things they read on the internet. And I realized that, you know, both in my practice and then also in this book, that the power of stepping back and showing them a map of what's going to happen over the whole experience and telling them the essential things that they need to know to have this go really well for them. I see that as a tremendous service to women because we're all so overwhelmed by all of the information, and I wanted to help women have it go really well for them.
So your book's name, the title of the book is it's unique, right? It's called New Rules of Pregnancy, and we know pregnancy has been exactly the same forever. So what is so new about the rules now for a pregnant woman that maybe you didn't even think about when you started your career in OB-GYN?
You know, the biggest new thing I would say is the amount of information that's available. You know, when I was pregnant 20 years ago, I went to Shakespeare and Company on the upper side and started paging through what to expect when you're expecting, and then I bought the book and brought it home because there was no other way to get information. And now women are overwhelmed with what they read, and they're worried that they're doing it wrong and making a mistake that's going to hurt their child forever. And so I wanted to let them know that what's new is that you shouldn't do that. You know, step back and talk to experts, trust the experts, get an overview, and then do your research. If you need to research focus things, you know, go to a couple of specific websites that we mentioned so that you can learn more, but don't feel the need to control it all yourself.
Now, when you first see a patient, what are some of the first things that you ask the woman? And if she comes with her husband, I mean, I'm sure that happens a lot, that it's not just one person you talk to. What are some of the first questions you ask them?
You know, the first, obviously I take a medical history. I find out about their background and their families and their medical issues. But then I also start with asking them what their goals are, because I think that very much informs how the prenatal care and delivery is going to go. So I say, what are your goals for this pregnancy? And I hear a lot of different things. I'll hear some patients say, I really want to have a vaginal birth, or I really want to give birth without any medication. I always ask them why. Or I really want, or they'll say, many women will say, I just want healthy mom, healthy baby, that's all that matters.
Right. Or
I've had women say to me, I really want to stop worrying. I want to have less anxiety during this process than I have. And that informs me about how I can best help them over the next 280 days to have this be a really good experience for them. And it's an unforgettable time. It makes a big difference in your life how these 280 days go. It's worth investing time and effort into having it be a great experience. Obviously, a healthy one.
And the way the book is laid out, it actually it does exactly what you just said you do. You find out what they do, what do they eat, what do they drink. You ask them about their history, which is really important. But I love the way it progresses to picking your doctor, and then the section on comfort and relaxation. Is that quick to get to, or do you have a lot of anxiety with the new mom before that? Like when you can recommend your book. I think it's wonderful, but getting them to be relaxed and realize that those 280 days are not going to be all torture. Does it take long to get someone there if they come in really just with worries?
In my practice and in all OB practices, I'm available to them 24/7 so that they can reach me. And so I tell them, make a list of your questions. Like I give them a lot of concrete tips. So for instance, there's a list app that I love that I use myself called AnyDo. I just found it on the internet. And I literally just type a letter on my phone and I can make this ongoing list so that when I'm worried about something, I put it on the list, and I tell patients, just write down everything, and then before your visit, you can email that list to me so that I can look it over and we can talk about the things that are on your mind. So I give them a lot of concrete tips about how to have it go well for them.
The beginning of your book, you talk about the mission of your book, and it really sounds like the mission of your practice. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. This is Joan Buckley from the Nursing Department here at Nassau Community College, and today we are talking about a new book, actually, The New Rules of Pregnancy, with Dr. Jaqueline Worth, the co-author of this book. Now, before we had the little break, the mission of your book is to guide and support all new moms, right? But you have a medical component. It's not just a book to read and feel good. It really has a lot of really good information. It talks about what to eat, what not to eat. You actually include it as a subtitle. Can you talk a little bit about what to eat that you teach a new mom who it may be the first time she's pregnant and she really is coming, could be a surprise to her, and now she needs to kind of, get settled for that healthy baby, healthy mom experience?
I find that, the question of what to eat overwhelms the first visit. They just are so worried that they're making bad food choices, that what they're eating is going to poison the baby, that it's not healthy enough. And so I devised a system to, make it really easy. So specifically, I suggest that they track protein, fiber, and calcium, because those are three, healthy nutrients in our diet. Yeah. And if you've got good protein, good fiber, good calcium, that has to be a healthy diet. It's not going to be, only bagels and cupcakes, right? And so I even suggest that they use an app. I recommend right now MyFitnessPal, because it's really easy and it's got a ton of foods in it, and that they periodically, not obsessively, but periodically just spot check what they ate yesterday and try to see, am I getting 60 grams of protein? Am I getting 28 grams of fiber? Am I getting 1,000 milligrams of calcium? And then if they're not, no disaster, but then just make some adjustments, add some Greek yogurt tomorrow, or, try to have more fish at dinner, or if you're vegan, it's especially important, then find some vegan sources of protein. And I think that concreteness of our advice really helps people not be worried and be able to take steps to take their health back into their own hands and be healthy.
There are a lot of, there really isn't much different about the pregnancy itself, but practices regarding pregnancy are different. Can you talk a little bit about what you've seen change from the beginning of your practice to now with an expectant mom, either from the very beginning? I mean, it sounds like you're really almost a teacher. They get a teacher and a doctor at the same time, which is huge. And they get someone that they can find comfort in, or like a consult, or what do they call that when you have somebody that's with you the whole time? You're with them the whole 9 months. Yeah, a companion.
We're with them the whole 9 months. Yeah, a companion.
So what's different about it today than it was when you started 20 years ago? In this 9-month period, what do you find that's really different that you had to make adjustments?
Yeah, thank you so much. A lot of things are different. I think there is an expectation. I see the couple come together, the husband and wife, or the woman and her partner come to the pregnancy visits together much more than in the past. Having this baby is much more of at least here in New York City, a collaboration between the two partners in a couple. And that's great. And so I also think this book can help the partner get up to speed on what's going on. But I do find that at the birth, there's a lot of pressure on women, whether it's from Instagram or from, seeing other people's photos, to experience it in a certain way. And I want to give them permission to not have to live up to anybody else's expectations, either their partner's expectations or their family's expectations. Take the cell phone out of your hand when you're having your baby, and just enjoy the mystery of that moment. It's a really private moment for a couple, and just enjoy it. And have your doula there with you. Let her take the pictures.
Oh, I'm glad you put it. That's right.
FaceTiming. You don't have to be FaceTiming your birth. That's a huge burden, and that's a big, big change. That was not happening before.
No, it wasn't. I think my youngest is 37. So yes, my husband was in the room, but it is a lot different because you do see people's deliveries go up on these social sites. But what's the difference? You brought up the word doula. This is interesting because we, as a nursing faculty, we do have students that are studying OB, and they, are starting to look at careers. What's the difference between a midwife and a doula? Because I know a lot of people know both. They have both.
Yeah, I hear that a lot. It's a really important distinction. So a midwife is a licensed professional who is permitted by state law to deliver a baby in the same way that a doctor is. And a midwife and a doctor differ in the scope of practice. Midwives are not trained to handle complicated pregnancies unless they're working collaboratively. So a midwife and a doctor are really the same. And I love midwives, and many of my friends use midwives. A doula is and so to pause, you're either going to have a midwife or a doctor, basically. You're not really having both.
Okay.
A doula is entirely different. A doula is a birth expert, somebody who is trained in the birth process and who is there solely for your physical and emotional support and that of your husband or partner. And so it's someone who stays right by your side, helps you with the different positions of labor and birth that you need to do, pushes on your back to help relieve pain, helps you figure out whether it's time for an epidural, helps talk to you about all the things that are going on so you're not so assaulted by the process. I personally feel that every laboring woman should have a doula with her. This is an area where I differ with some of my colleagues. I think some people may find the doulas, are not so eager to have somebody else in the room, but I encourage every patient and partner to have a doula there because I clearly see that it makes it go better. It's a way to embrace the experience. And
well, you make it sound beautiful. If I wasn't so old,
I can't say it with enough emphasis.
If I wasn't so old, it would be nice to do it again. No, it sounds wonderful.
It's a key thing. Yeah, you don't need to do this alone. To summarize, you don't need to do this alone.
That's true.
Get help.
Let's take a quick break right here. My name's Joan Buckley from the nursing department here at Nassau Community College. And today we're talking about pregnancy and what goes along with it with Dr. Jaqueline Worth, co-author of a book, The New Rules of Pregnancy. So you're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Man, do I love card night. You ready, boys? You got a king?
Go, fish, Dad.
Oh, come on. This is WWE superstar Titus O'Neil. It only takes a moment to make a moment. Take time to be a dad today. Learn more at 877-4DAD-411 or visit fatherhood.gov.
Brought to you by the U.S. Department of Health and Human Services and the Ad Council.
We now return to your family's health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us. This is Joan Buckley from the Nursing Department here at Nassau Community College, along with Dr. Jaqueline Worth, co-author of the book, The New Rules of Pregnancy, and a GYN specialist at Mount Sinai, New York. So, Dr. Worth, before the break, we distinguished the difference between midwife and doula, right? And you were saying that the bigger difference between 20 years ago and now is that the father is in the room with the parent. You know, he's been more involved in the physical delivery. He's there. He's supportive. But the doula supports him as well. And your book actually is also aimed at the partner. So I think those are really great things that you pointed out. I'm sorry, I think I interrupted you for a second.
Yeah, no, absolutely. I think my book is wonderful for partners and dads because it's a cheat sheet. You can read this book and you can know exactly what she's going through and be the best possible support that you could ever be. And I think that's great. I really treasure that part of it.
I appreciate this chapter on Eat Clean because a lot of times, not that we, I think couples do eat for fun, for companionship and all of that. And you point out some really great, I'm not saying the pictures are really good. I don't know if the recipes are in here, but it talks about 6 small meals. Now that's something a partner really needs to know when the woman isn't feeling well or whatever, and she still needs to eat. So 6 small meals is the name of the chapter. So I think a lot of things in this book really do speak to those around her. And I don't know if that's the feedback you've been getting from people that have already read the book or starting to read the book, because it is brand new. Has the feedback been positive?
Absolutely.
Yeah.
And having it speak to the partner was not, I wrote from my heart and I wrote what I see in my practice. And I didn't quite realize how well it spoke to the partner. So, I had a patient in my practice last week. I delivered her 3rd baby, and the dad is a police officer here in New York City. And he said, hey, Dr. Worth, you wrote a book for me. I have a short attention span, and I can page through this and really be able to help her. You wrote a book for dads.
I'm telling you. And there's even a chapter on big sisters and brothers. So I think you've included the entire family here. What about big sisters and brothers? What do you talk to your patients about when they say, I've got 2 other kids and this is my 4th pregnancy or 3rd pregnancy, whatever. What do you say to them to kind of get the siblings involved in this?
Yeah, absolutely. Well, just even a simple thing, when that baby is born, put the photograph of the siblings right there in the bassinet, so that when they first meet their new baby that they're going to be so excited about, they actually see their picture right there in the bassinet. Like, I get such feedback that this makes, changes people's lives. They're like, oh, there's my baby sister. It's going to be like a 4-year-old, right? Yeah. Here's my baby sister, and look, there I am already in there with her. Let's get it off to a great start.
It's funny you say that, because I think when my sister was born, now we're going back a long time ago, but I remember being so excited she was coming. I was so excited when she came. I thought I could just take her to school with me in a bag or whatever. So you're right. The way it's introduced is going to be huge as far as the relationships that go on for a lifetime, and that would help the parents. Now, how do you deal with there's something that we don't talk a lot about, and it's postpartum depression. And I'm wondering, is there a way of screening prior to the delivery for someone that may be at risk for postpartum depression? I mean, we obviously don't push it, but, what do you look for in someone that you think might be someone that would be subject to postpartum depression?
Yeah. First of all, I demystify it. I let them know that this is something that's real and it can happen. And even if it happens, it's treatable and it will end most of the time. I take a really good history in the beginning of every new pregnant patient to find out, did her mom have depression? Did her sister have depression? Or did she have depression in the past or in her first pregnancy? So those are key markers that would urge me to get support, get a therapist on board, get someone that she has in place so that in those overwhelming first days after the baby's born, she already has a number and a person that she can call who can treat her, essentially. I also screen my patients at 28 weeks with the Edinburgh postpartum depression screen, so I actually give them a score, and if they get a high score, I involve their partner, and I say, look, you got a high score, let's get some help on board. I find that to be really helpful, and then I screen them again after the baby comes to just check again, because you can't look at someone and tell if they're depressed, but the score can tell you.
No, in fact, the clown is always smiling, right? But sometimes he's crying inside. So, and that's, that goes along with many things, but this is just a topic. So, is there, in your practice, do you include one of the team members? Is there a psychologist or someone that you can just refer quickly to some patients if they need it? Oh, that's really perfect.
If my patients get a high score, I make sure that I connect them. New York City.
Oh, yeah, I forget. I'm
here, right? New York City is full of therapists. There's a therapist on every corner. So I just, I have a long list, and I just make sure that my patients have someone that they can afford that's, on their insurance plan, or that, that they can get into right away. Because, the baby is 2 days old, you're depressed, that's not a time to be finding someone to help you. It's going to be impossible at that stage. You want to have that stuff on board ahead of time.
Now, is there anything that, so the postpartum depression, that is something that we are addressing more now than ever. But is there a genetic component? You said you asked if your mom had it or anything. So there is a genetic component to postpartum depression?
Definitely a genetic component to depression. No question. And postpartum depression. It's not a curse. You're not doomed to have it if your mom had it. But it certainly means that you could be, you may have inherited her eye color and also her tendency towards depression. And so those people especially, I make sure their plan is rock solid, that they have in place to help them after.
Wow. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name's Joan Buckley from the nursing department here at Nassau Community College. And today we're talking with Dr. Jaqueline Worth about this really amazing book, The New Rules of Pregnancy. So now, what do you want to talk about? Is there anything I missed? Any questions I didn't ask you? Is there something that you really want to bring forward? I mean, the book is a beautiful book. It's actually hardcover, which I love. The photos throughout are real. They're not fake. They're not pulled off the internet. These are real, beautiful pictures throughout the book, which is like amazing to me to see a book prepared this way. What do you want people to know about this New Rules of Pregnancy?
I want women to feel empowered about how to take care of themselves, so that they know the steps they can take to feel well during pregnancy. How concretely, how to eat right, how to keep your food, what not to eat, how to avoid toxins, how to wash your vegetables, how to plan for your birth. And I also want them to take care of their bodies postpartum. So I tell every patient to do pelvic floor physical therapy after the baby's born, whether it's a vaginal birth or a C-section. Get a professional to help you strengthen those muscles back up so that you don't have, God willing, bladder leakage or pain, 20 years down the road. I try to help them get set on a good path so that, their bodies are strong and healthy. I think that's really important.
Now, after a mom delivers, does she, I know sometimes the GYN is sporadic, but during a certain period of a woman's life, she's very connected to her OB. Do you find that your patients come back to you when they're not using you for childbirth, just to really say thank you so much for that period in my life where you were there and helped guide me? Do you get any good guy letters? That's what I want.
Oh my goodness, I get emails every day with photos of babies.
Oh my gosh.
How are you doing? And I mean, I just love hearing from my prior patients and seeing the pictures and learning how well they're doing, and it just means so much to me. Yeah, it's a sacred trust taking care of a pregnant patient, and I really want it to go well for people, and I really believe that our book will help you have just that it honors that sacred trust, so that it will go really well for you, and it helps you keep open-minded and flexible. We can't will ourselves have a vaginal birth, even no matter how much you want it. Some babies need to be born by C-section, and a C-section is a life-saving surgery, and I put techniques in my book of how to use, how to ask for some of what's called a gentle C-section, which is a C-section that encourages mother-baby bonding right from the very beginning. So however it turns out, I want you to know you're going to be okay, and I try to put it all in the book so that you are happy and feel great.
Well, let me tell you, you do a great job with this, and I can hear it in your the way you talk about your patients, that this is a labor of love. Oh, well, labor of love, but because you
labor of love.
Yeah, there you go. But it's just a beautiful idea, and I'm really, really, really so glad that we got to talk about it today. But is there anything, if you had a little minute to give like a quick shout out to the listening audience or friends in the audience, what message would you want them to take away from today's radio show? What would you want them to remember that's really super important?
My basic message is, super important is don't overwhelm yourself with information. That's a bad road. Start with our book. Get an overview, get a doctor or midwife that you really trust, and then just let your body do what it knows how to do.
Do you have a website?
And follow our tips to do it. You can find the book. You go to Amazon.com and Google the new rules of pregnancy, and you'll see the book. And my practice is here in New York City, so Village Obstetrics. I would obviously love to see anybody. But if you read the book, you don't need to see me, because you have all the things that we tell.
Now, if they read the book, they're going to want to see you. That's what they're going to want to meet you, because it really is a really, really a nice book. This is Joan Buckley from the Department of Nursing, and I want to thank you, Dr. Jaqueline Worth, for meeting with us today and talking about the new rules of pregnancy. If anyone wasn't aware of them, they're better. And I want to thank you for being with us here on Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.